All right, I think I'm going to get started. I'm expecting a small group tonight. Obviously, we don't have too many pregnant ladies at the moment, but I'm doing this primarily for our social media. I want to create a virtual resource, if you like, for our clients, present and future. So welcome, everybody, and thank you for being here. This is a subject that is very personal to me. I had almost 20 years ago, I was blessed with twins. And this was a time when I was actually studying chiropractic in California. And it basically meant that I was on a very steep learning curve when it came to learning about dealing with pregnancy in a more natural way, and understanding how chiropractic can help improve the life of these soon-to-be mums. So let's get into this. During pregnancy, a woman's body goes through all sorts of transformations during and after pregnancy. Some of these are very easily recognized, of course, such as the expanding abdomen and, of course, morning sickness, and others are perhaps less well known. In fact, some of the common changes, physiological changes, can actually catch you quite by surprise. At any particular time during and after the pregnancy, the body's in a state of flux. The body's, the weight is increasing, biomechanics, how joints move, balance, all these things are constantly changing. And these changes put an awful lot of stress on the supporting structures of the body, especially the muscles of the low back. So what I'd like to do is start with the basics, and let's gradually get into this. If you have any questions, then pop it in the chat. I'm putting a QR code at the end, so if anybody who watches this material wants to contact me, then there is certainly my email address again. You can ask me any question you want. All right. So basics. Throughout a woman's pregnancy, there is a hormone release called relaxin, and it's produced to help loosen the joints and ligaments of the pelvis in order to prepare the body for the delivery of the baby. But this relaxin, these hormones which allow the relaxation of the ligaments, they're not specific just to the ligaments of the pelvis. It's also acting on all the other joints of the body, all over the body, and this can cause some instability and some dysfunction, which can certainly trigger pain. If we think about what's happening inside, obviously we're increasing in weight, an extra 25 to 30 pounds minimum. At the same time, the abs, the abdominal muscles are weakening, and the curvature of the low back becomes more and more accentuated. And it's very common to see pregnant ladies with a hand on their back there, like you can see in the picture here. And that's because it's fairly intuitive to try and open that joint, because there's so much tension and stress building up there. You intuitively know that you want to open these joints. I think we know that these changes, especially the changes of the weight and the accentuation of the curve of the low back, that's where most of the weight comes on. If you look at that picture there, all the additional weight is coming on at the front, and it causes the pelvis to roll forward. And that's putting a lot of stress on those joints and those supporting structures in the low back. If we look at where pregnant ladies tend to get their pain, it can be all over the body, really. And it's all part of the experience of pregnancy, if you like. For some it might be quite mild, but for some it can be really quite uncomfortable. Everyone, of course, is different, and each pregnancy is personal to the individual. Obviously, as the the uterus expands, you will gradually feel the stress and the aches and pains building up. And we also get, as the pelvis rotates forward, we can start to get a buildup of stress in and around the pelvic bones due to this pressure of the increased weight. Also the sacroiliac joints. Pelvic pain is very common in this situation, as is round ligament pain, which we will discuss shortly, and also sciatica. Sciatica is pain due to nerves being irritated in the low back, and that's sending pain down the legs. All right. Now, what we want to be definitely aware of is that we want to be very careful about medications here. Very, very, very careful. Let's talk about pain relief options. We want things to be as natural as possible, obviously. And let's think of things we should definitely avoid, okay? We've got to be very careful with medications. Always remember the medications might be helping alleviate some pain in yourself, but it's also going through the baby. You definitely want to be avoiding Advil, Motrin, this is ibuprofen. And we should really be very, very careful with these, because especially during the third trimester, because these affect critical blood vessels that are, there's a blood vessel called the ductus arteriosus, and this helps supply the baby. And these drugs can actually close the blood vessels and starve the baby of nutrients and oxygen. So that's not good. Always remember that anything you're putting in your body is going through the baby as well. That is a rule. If you feel that you absolutely must take some medication, then be very, very careful and do talk to your doctor. Let your doctor weigh up the pros and cons. Obviously, there are cases when it would probably be prudent to continue certain drugs. For example, cancer drugs or maybe antidepressants, things like this. But you've got to be very, very careful, and maybe it might be prudent to change the drugs that you're on, or make them less strong. Other things that you might be tempted to use that you want to be careful of are heating pads, which can be quite effective in reducing pain, but they can also cause harm to the baby by raising the baby's temperature. So be very careful. Don't be putting heating pads on that raise the temperature of the baby by at all, really. Try and keep them maybe on the pelvis at the back, or low down in the groin area if you're getting some ligament pain, but never more than 20 minutes at any one time. Now, I mentioned round ligament pain. Round ligament pain is very, very common. In fact, it's so common that it's almost considered normal, really. As the body changes and the tummy comes out and we get this rotation of the pelvis, then the supporting structures of the uterus, which are ligaments and some muscles and tendons, but I'm talking about the ligaments here, then these can become very, very tight. And this round ligament pain, you can see the round ligament in the illustration there. It's holding the uterus in place. But if there's imbalance in the pelvis, or as the pelvis is supporting the uterus, and the uterus is getting bigger and bigger, tummy's coming out, then this ligament, it can get very, very tight, especially during the second trimester, when these changes are happening very quickly. That's when you're more likely to feel it, right? So these are very thick ligamentous structures, really, that pull on the womb and pull on the pelvis, and it can be very, very very painful. It can feel like a sharp pain, or a jabbing pain, or like a deep ache in the lower belly or the groin area, and it can be both sides or one side. Perhaps more often it would be felt on the right side. So how do you alleviate it? Well, remember that this is a pulling pain. So we want to make sure that we're not exacerbating pulling. Things that could exacerbate it might be coughing, sneezing, laughing, sudden movements, rolling over in bed could shift the baby and cause tightening of these ligaments, standing up too quickly. These are all things that can cause this sort of shooting pain. Things that we can do, chiropractic can maintain balance in the pelvis, so it's not more on one side than the other. So that is definitely something to do. Keeping your core muscles strong during your pregnancy. We'll talk about that. Doing some stretching, making sure that we're balanced and moving right. This can all help. And just be very careful about how we move. No sudden movements. Be careful if we're gonna sneeze or cough or something, then you could actually lean forward and sort of take the pressure off your abs. That would be a good thing to do. What we want to always remember, I'm a chiropractor first. We want to keep things as natural as possible. Having a baby is the most natural thing in the world, and we want to be very, very careful about if we're doing things that are unnatural. In my experience, the more you get away from nature, the more you're sort of looking for problems. I did my training in America, and what I see in America, I see a country that's spending 2.5 times more money on things like pregnancy than in other advanced countries. And what's happening here is that the whole process becomes more medical. And unfortunately, we have to remember that the United States is now, I think, 46th in the world when it comes to health. But that's not just the health of us adults. It's also they're 46th in the world for healthy births. And they are actually the worst in the world for maternal deaths. So that's a pretty awful statistic. Worst in the advanced world, should I say, for maternal deaths. So we don't want to go down the American way at all. I guess we've got to also take into account that Americans tend not to be that healthy, really. But also their doctors really love their procedures, and they like us to take us down the medical route. And that's where chiropractic comes in, okay? This is why I always say that I don't want you to become a chiropractor, but I would definitely like you to start thinking like a chiropractor. And if you want to minimize pain, maximize function during pregnancy, and give yourself the best chance of a healthy delivery, then this is all part of what I call the chiropractic lifestyle, right? And if this is what you want, then you're in the right place. With chiropractic, what are we doing? We're helping you prevent, and we're treating back pain. We are reducing the risk of injury and the chances of developing long-term problems. So many ladies develop back pain during pregnancy, and it never goes away. It then gradually becomes chronic. So the earlier we can sort of get onto this and looking after our biomechanics and movement and core strength and good function, then the better, really. Chiropractic, which is the main topic of this talk, is safe, and it is all natural. And we always want to try and take things down the natural way, if at all possible. Think of it as health maintenance of the spinal column and the supporting structures, and then obviously the adjustments of misaligned joints, improving movement patterns, improving balance, and the balance of both muscles and ligamentous attachments, right? What does all this do? It reduces spinal stress, and that's not allowed to build up. We relieve stress from the system, and this can help promote the good delivery of nerves and blood and nutrition around the body, and specifically to where it's wanted during your pregnancy, right? When we adjust ladies who are pregnant, of course we are adapting and changing what we're doing. We've got to be very careful because of we know all about the relaxing, so we are a little bit probably even more precise than normal. We don't use excessive force, but we want balance. We are very much balancing the pelvis so that we don't get we don't become lateralized, meaning you're tighter on one side or the other. We want the baby to assume the right position. And what is very key with that is making sure that there's enough room, the pelvis is nice and balanced, and the muscles, which are holding everything in place, and the ligaments, they're also balanced. Okay, we don't want tightness on one side and weakness on the other. Balance is good. Okay, we're always looking to minimize stress as we go through pregnancy, and that stress is obviously physical stress. So physical stress are the gravitational forces, if you like, that I talk about a lot. That's where the tightness comes from. But also we want to try and avoid emotional stress, and the stress of life, especially life in a busy place like Singapore. Of course, there are instances when you perhaps should not use a chiro, and I can just run through a few instances, but always talk to your doctor. If you have any concern that something is wrong, talk to your doctor first. Definitely, you want to be careful with chiropractic manipulation if there's any vaginal bleeding or if there's any problems with the placenta. So that's placenta previa, where the placenta is in the wrong place. Placenta abruption, which is where the placenta has separated from the wall of uterus. In cases of ectopic pregnancies, anything like that, we want to be very, very careful. All right. So speak to your doctor first. We as chiropractors, we are very, very happy to talk to your OBGYN. We want to be part of the team, right? We don't want to be excluded. So both there is a place for the medical team and the more natural support team, if you like, to work together. Okay. Chiropractic adjustments can also help reposition the baby, and quite often as the baby grows, they can get into the wrong position, and it's quite good that the baby is encouraged to move around, and we want you moving during pregnancy, and chiropractic helps keep you moving, helps keep things in balance, and ideally, we'll talk about it in a moment, but ideally you'll be doing some kind of rhythmic movement that encourages the baby to move. I know that I certainly had my wife during her twin pregnancy, sitting on an exercise ball. Some people call them pregnancy balls, all the way through her pregnancy, and just sitting on it with rhythmic movement definitely helps. All right. Some doctors, some chiropractors also suggest the use of pregnancy or belly belts, if you like. I'm only a proponent of these when they're needed. So if there's a lot of pain, a lot of instability, but they can definitely help. So you can have a sacroiliac belt like this, which basically supports the low back and the pelvis. I think that picture on the left is quite good in that you can actually see what it's doing there. It's really taking the weight, and this will relieve some of the weight from the low back. All right. I do want you to know that people who use this get the best results when they use these in conjunction with other natural treatments like chiropractic. All right. So if you're getting some pain, don't just go for this. I think that you want some natural care as well as this these supporting belts. Right. Any downside on these? Nah. You don't want to be relying on it all the time. So you don't want to be wearing them for too long periods. That's for sure. They may affect the blood flow to the abdomen because they're putting a lot of pressure in there. And you know, if you wear them all the time, there can be some rubbing and it can cause some pain. Okay, so you know, I think it's good that you wear these for short time. So maybe if you're just wandering off down to the shops, or you're doing a little bit of work around the house or something like that, then you could wear the belt for short periods of time, and you'll probably find it'll help you. What about sleeping? Many ladies get pain during sleeping, so try not to sleep on your back. Sleeping on your back is not good. That can put pressure in the wrong places, and you really want to be sleeping on your side. So, like in this picture, the use of cushions is a great thing. Cushions between your legs can actually reduce some of the weight of your leg pulling on the pelvis. Some ladies like a great big, like a long bolster, which they sort of, while you're lying on your side, they can sort of cuddle into. They find it very, very relieving and very reassuring, if you like. You definitely want to be sleeping on your side, right? Let's talk about some exercises. So exercise during pregnancy. Generally, and mostly, doctors will advise their clients. Definitely, chiropractors will certainly be advising nearly all their pregnant patients to exercise while pregnant. Right? We are preparing your body for one of the most important things that you will ever go through. It's all very natural, but you've got to give the body the best chance for this to be a huge, great big win-win, a big success. Key points to think about. Being active is good for us all the way through life, and especially when we're training our body to have a baby, right? We're building resilience, and we're building strength, and we're building stability, balance, all these things. Okay, so like some other exercise is pretty much safe. Okay, usually safe. Think in terms of walking, swimming, stationary cycling. These are definitely things that are, we can call them pregnancy safe exercises, right? We want to be avoiding high, this should all be very intuitive and make complete sense. We want to avoid high impact exercise and exercise with any risk of falling, right? We don't want to get hit in the stomach. We don't want to fall. We don't want to overheat. We don't want to overtax our system. We just want to condition our body, right? So for me, I think stationary cycling would be great. Swimming, walking, really, really good. Always listen to your body. Listen to your body all the time. You should be checking with it all the time. If you think there's maybe something wrong, then make sure you're checking in with your midwife or your doctor, OBGYN, whoever is on your team, right? We certainly want to be looking after our core, right? Core. Think in terms of knee planks. So these are planks that you do on your knee, okay? Rather than doing a full plank, maybe just a knee plank. And you can do that on your front and on your side. So side planks are also good. You can also do things like bridges, which is when you go on your back. I think I've got a picture of that coming up. Always listen to your body. When it comes to exercise, I'm a huge proponent in making it fun. And in your community, there will almost certainly be support groups. Think in terms of, your gymnasium, your any community centres. Have a look in your locality. There will almost certainly be groups that you can join in, and that will help reassure you. It'll make it fun, and it's always best to do things with other people that are going through the same experience, right? It's always good to share these experiences. When it comes to exercise, there are a few myths that I'd like to dispel. One is that if you don't usually exercise, you shouldn't start during pregnancy. Wrong. Pregnancy is a time when you definitely should be doing something, right? You do not want to be just deconditioning during that period. Your body will slow down naturally during this time. You will definitely be wanting to find more time for rest and looking after yourself, but do not just sit there for 9 months and decondition, right? You are asking for more trouble in the end. We want to be working our body, our heart. We want to be working on muscles a little bit, but you know, nothing too vigorous. All right. Myth number 2: athletes who are used to vigorous exercise, can they continue with their vigorous exercise? Not really. You've got to back off. You've got to listen to your body. When you do vigorous exercise, it's putting a lot of force through your system, but it's also releasing things like stress hormones. And remember, hormones that we release for ourselves are also going through the baby. So you don't want to be creating stressful situations, and vigorous exercise is one of these. The third myth that I want to dispel is that the only reason for exercise during pregnancy is to help you lose weight after the baby is born. No, it's not. We are toning our body. We are working on the physiology of our body that will help the baby. It will help yourself, and yes, it will help you lose weight afterwards. After you've given birth, it will. But this is not the only reason. All right, you want to be doing it for your baby. You want to be doing it for yourself, and we want to be creating some early good habits that you can get into, as you can get into a nice role as you go through pregnancy. All right. It's a more simple core exercise. I mentioned the bridge. That's what a bridge looks like. There are lots and lots of. I think it's really good to educate yourself. I know that when I started to learn as much as I could about pregnancy and what we were going to go through as a couple, we got books, we looked on the internet. It's a really good time to educate yourself. There are so many YouTubes out there. There is so much information. Just today, I'm just concentrating on the basics, if you like. So what about stretching? Is it possible to stretch too much and you can hurt the baby? Well, actually, yes. You don't want to be stretching deep into the abdominal area. So be careful with great big twisting exercises. Remember, we've got relaxing. That's letting things open and stretch, if you like. And also the baby's growing. That's also doing a lot of stretching inside you. So be fairly gentle. We want to do gentle twists that do not compress the belly, right? I think this should be fairly intuitive. We definitely want to get movement in our body, but we don't want to put a lot of stress on these supporting structures of the baby, right? People ask me about massages. Is it good to have massages? Yeah, massages. Everybody likes the massages, and when you are going through a pregnancy and there's a lot of stress in your system, a nice massage can be great. But really be very careful who you go to, and I think you should definitely only go to a therapist who has been trained in massaging pregnant women, right? the takeaway when it comes to stretches is listen to your body. Don't go too far. Make it consistent. It should be comfortable. You should feel good afterwards. What are we doing? We're helping prepare the body for labor, but do not overdo it, right? Same with all exercises during this period of time. Do not overdo it, and definitely listen to your body, right? But we want you exercising, okay? Almost 100% of doctors will agree with me that exercising is important, right? So let's talk a little bit about posture. We want to be sitting in good posture, standing in good posture. If you spend a lot of time standing, then it's good to raise one foot. So you can have like a block or a little stool or something to raise one foot. And so if, for example, if you're standing, doing some housework, doing the dishes or something, it's very good to perhaps just raise one foot if you're standing for a long time, and that will take the pressure off the back. And then, of course, you can alternate from side to side. Movement and stretches. Let's just think about some of the benefits and what we're trying to achieve. We're trying to achieve improved circulation, reducing fatigue. We want to relieve stress. We don't want stress to build up in this time. So we want to quiet the mind. We want to try and have quality sleep. So chiropractic helps. Simple exercise helps, stretching helps. We want to be digesting our food, right? We want the body to be working well. So if we can keep the body in balance and moving, this will help improve digestion. It can help reduce pain. So if we're getting any cramping or any ligament pain, then gentle stretching can help. Of course, we are building up muscle tension as the baby grows inside. So gentle stretches and of course chiropractic will help relieve all that. Okay. So let's think about things that you shouldn't do, right? There's plenty of things that you should be doing, and a lot of it is very intuitive. But let's just think about what we shouldn't be doing. As we progress through pregnancy, or as you progress through pregnancy, during your second, third trimester, that's when you're becoming bigger. Obviously, we don't want to be lying on our stomach, so don't be doing any exercise or stretches that involve lying on your stomach. Anything that puts any stress in the baby, on the belly. So remember, as the baby's growing inside us, the uterus is becoming tight. That is separating the muscles of the abs, right? So the abs are becoming weaker. So don't be putting too much pressure with big twists and things like that. Be careful about too much lying on your back, because this could cause reduced blood flow to the baby. So don't spend too much time lying on your back. And then I think the big one is avoiding too much twisting. Okay. Now, some exercises that I think all pregnant ladies should go through. Simple things. You've probably heard of the cat-cow poses. These are gentle, rhythmic stretches and movements. Well, these are yoga movements that you can go through. These are really, really, really good, right? As the pain builds up in that low back, a great thing to do is go for these big forward bends. And you can do it standing like you see there, or you can do it sitting. If you're sitting, you just basically bend all the way forward and just feel your low back open. You can also do something like this, whereby you're opening up, you're supported by the back of a chair, but it's opening up that low back. That's going to feel good. As you get lots of tension building up in and around the pelvis, the low back, and SI joints, it's really good to have a foam roller handy. And like this lady's here, you can direct the pressure to where you want it. just spend a little bit of time, maybe 30 seconds or maybe a little bit more, just finding the spot where that pain and tension is, and just move that roller up and down it, and you'll find this should alleviate things quite nicely. If you're getting pain in the glute area, this is very, very likely to be piriformis pain. So we can start doing some seated piriformis stretches like you see there. So whether you're sitting on the floor or sitting on a chair, you basically, on your affected side, you'd bring your leg up, cross your legs, as you can see, stretch your spine nice and tall, and then just lean forward, and you'll feel that area of tightness in your glutes, and you'll feel a nice stretch coming onto that. Okay. Obviously, you can repeat this. Don't do anything too fast. Be very respectful with the body, and just do it slowly and gradually build up. You can direct the force to exactly where you need it. Okay. Another great one for pregnant ladies is a pigeon pose stretch, which you can see there. Hands and knees on the floor. Slide your knee forward to between your hands, and then slide your other leg backwards, and then gradually lean forward, like you see the lady on the left. And you'll feel a really nice stretch in and around that pelvic region. Okay. Same time, as your pelvis is rolling forward, we want to get some stretches in the hip flexors. So the hip flexors are these ones right in this area here in the groin area, and you can go into that position. You can see in the picture, kneel on the floor, on your hands and knee. So you're kneeling on the floor like that, one leg backwards, and then just ease yourself forward and shift away forward, direct the stretch right into that groin area. You'll feel it. And it becomes an intuitive thing as you find the right spot. And again, just slowly lean forward and increase the stretch. It'll feel good. When it comes to the stabilizing the pelvis, then a couple of great things you can do. One is Kegel exercises. So that's when you increase the internal pressure inside you. There's plenty of YouTubes that show you how to do that. I'm not going to do it. I'm not going to do it here and now. Another good stabilizing exercise is the fire hydrant exercise, which you see this lady doing here. So you're down on all fours. You lift one leg up to the side, and you're holding it up there, and you're getting you're strengthening your core, but it's also strengthening the pelvic floor. Okay, this is called fire hydrants. Now, I mentioned before I had my wife bouncing on a ball. Such a good thing to do. Such a good thing to do. I believe that if you are early in pregnancy, one of the best things you can do is get yourself an exercise ball. Exercise ball, pregnancy ball, whatever you want to call them. Pregnancy balls tend to be slightly larger, perhaps, than the normal exercise ball. You want to be sitting nice and high, really. Make sure your pelvis is above your knees. And you're basically just going to get on the ball. You're going to move slowly. You can roll from side to side. You can move from backwards and forwards, and you can do sort of rotary movements. You can do gentle bouncing. This is stirring things up gently. This is working the muscles, the reflexes. It's all very, very, very good for you. I'm a huge proponent for these. There are so many YouTubes on these. Get a ball, find a YouTube that works, and then just work through it. Always listen to your body, and always be very respectful of what's going on. But this is great for all sorts of things, really. It'll certainly help position the baby. You know, that gentle movement can help move the baby around inside you. Again, always listen to your body. On those problematic pregnancies that I mentioned before, probably not a good idea to be bouncing on a ball, but always ask your doctor, okay? Always make sure your hips are higher than your knees. Make sure that you are in balance. So remember, no falling allowed. If you think that you're a bit unsteady, then you can hold on to a chair, perhaps. That would help, right? Always listen to your body. That is my golden rule. What about postpartum pain? Obviously, being a new mother is it's tough enough, really. It's a big event. You've just gone through this very, very emotional and traumatic to your body, if you like. And you expect the pain to go, but unfortunately, ladies tend to spend very little time in hospital after the delivery, and then they're sent home at a time when really the pain hasn't gone away. So unfortunately, lots and lots of ladies have postpartum pain. It tends to be not in one position. You might have it might be pelvic pain, it might be the sacroiliac, it might be all sorts of pain. A lot of ladies get a lot of tension in their upper bodies because they tend to get a lot of time when they're leaning over their new baby, can get a lot of tension across their shoulders and their upper back. So it's a time to look after yourself first. So that is the golden rule. We see lots and lots of ladies that have had their babies, and they come into our clinics. We check babies very, very early on, but we want to get the mother working as quickly as possible, get things moving again, get the body back into balance, encouraging strength and resilience, because you've now got a very, very important job, right? You're building this baby, you're working with this baby, and you want to give yourself the best possible chance. Best possible chance is going to be some exercises to improve balance and strength, pelvic girdle, stabilization exercise to strengthen that whole area. Remember the fire hydrants, remember the Kegels. These are all good for postpartum pain, right? Right, getting towards the end now. I just want to go through some essential nutrients for pregnancy. Obviously, it's a very, very, very important time. Hopefully, you will be breastfeeding after your pregnancy, and you want, again, the best possible chance for yourself and for the baby. So nice balanced diet, healthy protein, fruits, vegetables, whole grains. Try to steer away from processed food and stuff that I don't really even consider food. You know what I mean. Careful of sweets, careful of bad fats. There are certain nutrients that we definitely do want to make sure we're getting into our body. I'll just run through those. So folate is a B vitamin, B9, very important for cell division and building healthy organs inside us. Iron, we want iron to help build the red blood cells. We definitely want to be avoiding anemia. Vitamin B12 for helps form blood, but also for many, many other processes within the body. If you are a vegan, you must be supplementing this. This only comes from food from animal products. Okay, we want to make sure that we're getting enough omega-3 fatty acids. So this comes from deep water fish. If you think you might not be getting enough, then definitely you want to be supplementing. I want to mention vitamin A. Vitamin A is important for cell growth and cell division, and also to build healthy tissues, right? Obviously calcium, both for yourself and for the baby. And for calcium, we need vitamin D. Remember, vitamin D also takes the calcium into the body. And then finally, vitamin C is very important for collagen formation. So collagen is important for the formation of bones and muscles and blood vessels. It's very important that we have enough vitamin C to help build all this collagen that you're going to want to be building. Oh, okay, I've gone through a lot of stuff there. I'm just going to check the chat, see if there's anything in there. Can't see anything at the moment. Just want to finish off with a QR code there. If anybody needs any information from us, or anybody, if you know anybody that needs to come in to our clinics, know anybody that's becoming pregnant or suffering from pregnancy pain, please help them find their way to our clinics. There's a QR code that will help people get into our clinic for a reduced rate. I'm not seeing any questions there, so I think I'm going to wrap up. Okay, so thank you for listening to me. I've enjoyed being with you tonight.